Morning. It is Thursday, July 16, 2026. I'm Dr. Deukmedjian, CEO and founder of the Duke Spine Institute. Our patient presents to us with 20 years of back pain. On examination, I found that he had pain emanating from the facet joints on the right side at L4-5 and L5-S1, as well as his sacroiliac joint. So we decided, hey, we're going to treat these with our Duke plasma rhizotomy procedure and try to get rid of the pain. As you can see, let's look at some of the anatomy here. Shot right there. Before you do that, injection. Take your knife away. And let's look at the anatomy. All right, no. So Jordan, show the audience, take a shot, show them the anatomy. All right, you can see, show the vertebral body. We're looking front on to the spine. Show the pedicles, left pedicle of L4, right pedicle of L4, transverse process coming off the pedicle and facet. And then you got the 4-5 facet on the right side, just down below. Yep, down below. Right there is the 4-5 facet. And then the 5-1 facet below that, further down, yep. So we got those two facets to treat, and then we got the SI joint. Show them the SI joint, sacroiliac joint. It's one of the most common causes of chronic back pain. Now, let's show the audience the 30 different causes of back pain while we work through fixing this gentleman. I'm Dr. R. Deukmedjian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks. Welcome back. So you could see that there are 30 very specific causes of back pain. This patient has 3 L4-5 facet on the right, L5-S1 facet on the right, and right sacroiliac joint. Let's show the audience how facet joints become painful, and then how we use our Deuk plasma rhizotomy to destroy the pain nerves.
Your facet joints keep your spine moving. When they're injured, the capsule tears, inflammation sets in, and chronic pain follows. Deuk Spine Institute can help. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You've just watched how we treat facet joints that are painful, and now I want to show you how we treat sacroiliac joints that are painful. Let's show the audience how an SI joint gets injured and becomes painful through the process of arthritis. And then we're going to show you how we use our Deuk plasma wand to go into that joint and destroy the pain nerves that are causing people's back pain in the joint.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Questions?
This patient had facet joint pain in his lower back, causing chronic back pain at L4-5, L5-S1. He had SI joint, right sacroiliac joint pain. So we treated both the facets and the SI joint today. And all of this is done minimally invasive. There's virtually no bleeding. We lost maybe 2 cc's of blood. And he's going home in about an hour. Our success rate is over 95% of curing the back pain and SI joint facet pain. And cure means it doesn't come back. So that's what I'm hoping for him and expecting for him. All right, any questions from our audience?
No questions.
Have a wonderful day. We'll leave you with one of our patients who had this procedure done. And good morning. I'm Dr. Deukmedjian, CEO and founder at Duke Spine Institute here. I have a patient who came to us with severe, debilitating pain coming from below his spinal fusion in his lower back. He had sacroiliac joint pain on both sides, and there was no getting rid of it. There's only one treatment that works, and it's the Deuk plasma rhizotomy offered here at Duke Spine. It's now patented and it's FDA approved. His insurance approved the procedure. He had it done yesterday. How do you feel today?
Great. That 99% better than I felt 2 days ago. Not kidding you.
And are you on pain meds?
No, I'm not.
Do we put you on some new meds that took away your pain, or is this from the procedure we did?
This is from the procedure.
And we did it less than 24 hours ago. Here you are back here. It was outpatient. Your pain is gone. You're not on any medication. There was no bleeding, no hospitalization necessary, and 2 tiny little 4mm punctures on the skin. You happy?
Oh, absolutely. I'll give you a kiss if I liked you.
You like me.
I
You
know,
already
I
gave me a
know.
hug.
I
But
know.
kisses are off limits. My wife is the only one. My kids. That said, I've known you for a long time.
Oh,
We did your fusion many years ago. Because of the fusion, you wore down those SI joints pretty quick. So that's why we had to do your procedure. Very common in patients with fusions in their backs, they get what's called adjacent segment disease. And what that means is when you fuse a part of your spine that's meant to be bending and twisting, then that puts strain on other joints above and below, and they wear out faster. We do not recommend fusions on anybody, or laminectomies or discectomies, because they lead to fusion. We did your fusion many years ago.
oh yes.
Your insurance did not want to do the laser. They only wanted to do the fusion, so we did it. And now we're dealing with some of the sequelae of that, right?
Yeah, workman's comp was tough.
And people say work comp patients don't get better. Is that true?
Oh no, depending on what doctor you have.
That's right. And what treatment you have.
Yeah, absolutely.
If you have the right treatment, work comp patients get better. Isn't that true?
That is absolutely true.
Is there anything you want to tell your fans out there?
I'd like to start out by telling you in 1982 is when I first had this situation happen during a 5-car accident. And I've been living with pain forever, seemed like. Today I don't have any pain. I mean, I just don't feel any pain. That's how far I've come, along with this man, of course. Without him, I don't know what I'd have done or what I've done. One nurse one time gave me go see Dr. Duke. He's the best. Well, he is the best. Thank you.
You are why I do what I do, to
Thank
help
you.
people just like you, suffering, to try to give you some decency and quality back to your life.
Even all the complaining, I said, I don't want it, I don't want it, I don't want it. You kept talking me into it. I'm glad you did.
You're
I'm
welcome,
glad
my
you
friend.
did.
You're welcome. Enjoy your life.
Oh, I will. And you too, huh?
Thank you.
You're a good guy.
Thank you. I appreciate it. All right, let's get you out of here.